My name is Denise, and this is my little own personal knee surgery one-on-one class. Um, I am currently 8 weeks post-op from my right knee partial replacement, and tomorrow I'll go in and get my left knee done. And I thought it would be good since I'm packing to do a little video about all the ins and outs and what to expect from those who haven't went through it, and just a little bitty stuff that I learned that I'm also going to be using the next go around starting tomorrow. Um, so, a little bit about my history. I have, a few years ago, I had arthroscopic knee surgery to have my meniscus removed, and a knee replacement was in my future. And it just got to the point where I can't even walk, a couple blocks in my neighborhood without my knees aching. So, my first knee was done 8 weeks and 3 days ago, and my left one will be done tomorrow. So this is just little bitty tips and tricks that I've learned that have helped me. I am by no way, shape, or form a medical professional, and also everyone is different. I think just from the people I talk to, I'm kind of in the middle. Um, so right now with my right knee replacement, my extension is 0, and my bend is about 110 to 115, depending on how I feel that day or what I did the previous day. I will say I still have tightness in my right knee, but it actually does feel better than my left knee. But it's like hit or miss, which one feels the worst, which one feels the best. So I'm gonna go in tomorrow. I'm not necessarily nervous or scared, but I will say that knee replacement surgery is one of the most difficult things that I have experienced or I have done. I'm not looking forward to it at all. It was tough. The first I'll say 2 weeks was tough. The surgery itself went fine. I came home, and then about day 3 was when it really started to hit. So I'm not really looking forward to that. At this point, I'm back to driving. I was back to driving after about 4 weeks. Um, and I was taking a bath after 4 weeks, so I'm not. You can take a shower, a few days after. But as far as bath and putting your wound in water, that'll be up to your doctor. Although it says up, you do have to up to your doctor. But also, I will say one thing I didn't do. I didn't have a plan to get out of the bathtub after I first got in the bathtub, which took me a while to get out of the bathtub. I enjoyed my time in there, but getting out was a challenging. So I'm just going to go through a few products that I have found extremely useful along my journey. So I have a group of different things right here. So I'll say the most important, the day of surgery and following a few days after surgery, um, was one of these leg things. I forgot what it's called. Please forgive me. I bought a kit for knee replacement surgery, knee and hip replacement surgery. I just bought the kit because I didn't know what to expect. But this, and starting tomorrow and for the next week after, was one of the best investments that I had. It helped me get out of the bed, get out of the shower anytime I was sitting down. And I'll go through. So basically, those of you, it'll be really hard to bend my leg after tomorrow. So, I use this. If I was getting out of bed, I would use this, and it helps. Of course, tomorrow I won't be bending this knee like this, but to get out of bed, it helps. This this was invaluable. I'll say my first 2-3 weeks, it was just um invaluable. And some people you can kind of makeshift it, but this is, it's like, it's hard, and it's like a hard wire in here, so it can be used. But even once I was even able to bend my knee, I was also able to like lie down and stretch my knee backwards. That was so that was a very, very valuable tool. um, so that was number one. And of course, this is pretty much self-explanatory. I used this walker for about 2 weeks, roughly, until I switched to a cane. And it was invaluable. I did buy skis. I guess it depends on your surface. You can buy the tennis balls or just scoot it around. But they actually have you to have this. And then, of course, there was handy dandy cane, just a basic simple cane. Is also what I used. Another thing that I found extremely valuable is my bath chair, which you can see right here. It's a bath chair with handles. A shower chair with handles, shower bath chair with handles. And one great thing that I also found about this shower bath chair, it's adjustable height, so it was great in the shower, but it was also good like when I first started doing my sitting exercises, to do my exercises in the chair. Because you'll, if you haven't done it already, you'll know how to do your knee bends, where you come forward and try to get more and more angles, and you also got to do leg raises. But the shower chair was very valuable in the shower and outside the shower. And I didn't mind spending a little money for everything, because I knew I had to have 2 surgeries. Bilateral, which is like both at the same time, just wasn't, my doctor didn't think it was a good idea for me, for other reasons that I won't get into right now. But I knew, like, soon as I get better, I was have to go need all this stuff again. So I'll go through a few other things that I actually found valuable. One thing was a pill box. Now, this is just your standard pill box. I'll bring this a little forward. But once I get on my medication, I would suggest to get one of these, or the flat ones, or whatever. But as opposed to have it how it has Monday, Wednesday, Friday, Monday through Friday on there, I found it, get a piece of masking tape and do the times. Because if you're drugged up, especially for the first couple of weeks, it's just like, did you take that? Did you take that? Especially if you have more than one medication to take. Do the times, like I said, just a piece of masking tape, and do like 2 o'clock, 8 o'clock, 4 o'clock. I don't have it yet because I don't know what my schedule will be just yet. But and as you'll know, and hopefully you find out, or not to find out, it's best not to skip, especially those first couple of weeks. If you're supposed to take your medicine every 4 hours, you need to take it every 4 hours, because if you wait too long or forget, you'll it takes too hard to get back up to that pain management level. So this is valuable, especially if you're by yourself, or even for your caregiver, to know what you've taken what hour. So that's one thing that's extremely valuable. Another extremely valuable thing is that so you're not supposed to have anything like under your knee to bend your knee or anything like that. But what I found, I got this wedge. So this is actually a wedge, but when it shifts like this. So this is just a wedge. And make sure you don't get one that bends. And so this works great in the bed. I will put one. I actually end up buying 2, so it almost like I was in a hospital bed. So I have one this way, and then one up on my feet. And a lot of times, this is a recliner that I'm on right now. And what I would do if I needed to elevate with ice, I would put my foot up here, and sometimes I would put a pillow just so your knee is completely straight, because there shouldn't be any bend in the knee. But this is a valuable tool for sleeping, for getting comfortable. And sleeping is one of those things that, if you don't know already, you'll find out. It's extremely difficult to find any comfortable, if you're a side sleeper like I am, or you're anything other than a back sleeper, it is extremely difficult to get comfortable at night and to not wake up without pain. It's just very uncomfortable. So like I said, this I found to be a very, very valuable tool for sleeping and getting comfortable. The first night, I'll say the first week, I actually slept right here. And then I eventually got this wedge. This wedge was also approved by my at-home physical therapist, who I met with 3 to 4 times a week in my home. And he actually is the one that suggested this wedge to actually sleep on. And before I got the wedge, I was right here with pillows. It was very uncomfortable, but that's what I did for the first, I'll say, a few days. And then some other stuff that came with it. This is just an extra large shoehorn. I did use it a few times, but for the most part, I didn't leave the house for like a month almost, until it was time for me to go to physical therapy, outpatient physical therapy. So it was valuable, but I only used it a couple times. So I used it, but depending on how much you're leaving, worth it or not worth it for you. And this little concoction, it came with it, and it came with the kit that I bought. And this is actually, I used it a few times as well, which is really nice. It's just a sock thing, so you just put it on here. I gotta try to get this backwards so you can see this. You put your foot in there. Of course, you won't be bending it when you need this. You won't be bending your foot, but it does that. And then it also comes with the hooky thing, and you hook it up once you get it on your foot, and you just pull it right on up. Now, this hooky thing is kind of cool because I've used it for other stuff, but I only use it a few times. But another thing I actually did have find to be very useful was a reacher. This is great if you knock your medicine bottles on the floor, cell phone on the floor, just anything you need to pick up, especially when you can't get out of bed, so you don't really have to have someone at your exact beck and call if you need something. It also helped a few days after, a week after, just for reaching stuff, because it was just hard to grab stuff that I would normally be able to do. So this thing was extremely valuable as well. Okay, and one more thing now. Some people buy ice machines. Some doctors or hospitals or whatever you go get your surgery, they give you different things. I got one of these, and they usually laid it that way. This also wraps around your knee like that, which it was just great for me because I can wrap it around in bed. I can walk around with it. I still find it very, very useful. And also, they gave me 2 of these things, 4 of these actual little ice packs in the hospital, and I actually ended up buying 2 more, which was very inexpensive because I just found that I needed ice more, and it wasn't freezing as quickly as I would like. So this is one thing they might send you home with for that. Another thing which I received a few years ago when I got my meniscus, they sent me home with this, and this is very similar to an ice machine, except this one is it's manual, so you pump it, and literally you fill it up with ice, and then you wrap it around like this. During my knee surgery, I did like having both because this one will stay relatively cool all night if I just squirt it with fresh water, if I fill that up with ice, as opposed to this, after like an hour or two, it's no longer cold. So I did use them both, and I'll use them both again, I'm sure, starting next week. I still use this. I don't use this as much because usually I just go to bed with this or wake up with this or when I do too much. So this works wonders. I think that's probably okay. One more thing, yay! This, a couple more things actually. So this is just a house rolling pin. This has worked wonders. So I just use it and roll it, and it feels really, 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 really good. It still feels good even now. So just kind of use this rolling pin to. Oh, that feels good. So this is one thing. It's just a house rolling pin. That's all it is. And it works wonders. I roll it up my calf sometimes. If whatever muscle is sore on my leg, I just use this. I keep all this stuff in a little bin right next to me. And then too, very basic, vitamin E oil. I don't know. I use it on my scar daily. My scar doesn't look too bad for 8 weeks. Bring it in for a closer look of my. So that's a 8-week knee replacement scar. And I do put vitamin E oil on it every single day. And yeah, I can bend it and all this kind of stuff. Bend it pretty well. So that's that. Hopefully you found this video helpful. Like I said, I'm no expert. I'm no doctor. I just went through it once, and I'm going through it again tomorrow, which, like I said, I'm not looking forward to. But if you have any questions or comments, please feel free to leave them or ask me any questions. But like I said, just remember, every single person is different. And I'll say physical therapy, you do have to really push yourself. I've been through natural childbirth, and I'll say this is this is more difficult than that. So if you have any questions, comments, everybody's different. Every doctor's different. Every therapist is different. Just keep that in mind. I like my therapist. My therapist pushes me really, really hard. There were many times when I was in tears going through physical therapy, but also like at 8 weeks, I feel really good about my progress. And up until, actually, until yesterday, I was up to walking 2 miles a day from not being able to move my leg at all. 8 weeks later, actually, I was walking probably 2 miles after about week 5. I slowly worked up to it. 1 block, 2 block, 1 mile, and I was up to 2 miles a day, plus riding my stationary bike. Which, when I first started riding my stationary bike, I couldn't even get my pedals all the way around. I had to go that way and then this way until I worked it. So I was doing that for 30, 40, anywhere from 30, 60 minutes a day, just depending on how I feel and how much I did around the house. But every person's different. Every doctor's different. Every surgery's different. I'm hoping this will be a little bit easier, but don't really know until after it happens. So, like I said, feel free to leave me to questions or comments. And good luck on your surgery.